13th, 2014 Human Services Committee meeting to order. First item on the agenda is approval of the printed agenda. Looking, oh no, looking for entertainment of an approval. Oh my, reminds me of
Support.
Middle schoolers, yes. We have a motion in support of the agenda as printed. All in favor say aye.
Aye.
Those who oppose, agenda will be accepted as printed. Public comment. Are there any individuals in the audience that would like to address the public? Or address the committee? Seeing none, we'll move on to the September 8th committee meeting minutes. It is attached.
Move to approve the minutes.
Support.
We have a motion and support of approval of the minutes as printed on September 8th. All in favor say aye.
Aye.
Opposed? Minutes accepted. Lifeways report. Mary Beth, thank you.
Good morning, Commissioners. For this month's report, you'll see that it's I sent you quite a bit of information. Wanted to provide some background related to our strategic plan and accomplishments as an organization over the past 2 years, and then planning looking forward. In this packet, you'll see the report to all staff, and in that packet, it kind of talks about the challenges, the environmental things that the agency faced over the last 2 years, primarily things around risk management due to funding, also looking at the current building that contributed to the structural deficit with Lifeways, and the fact that the change related to going from a PIHP to a community mental health over the past several years. So in the packet, a couple of things I wanted to point out was related to the current status related to general fund, because as you know, I've talked about the fact that we've seen a decrease in general funding from $6 million to $2 million for this fiscal year. Some of the accomplishments as an organization is that we actually are going to end up related to general fund with a surplus. That will probably, a good percent of that will have to go back to the state, but it's because of our ability to manage those general funds significantly related to state inpatient, and that we reduced the number of individuals that were in the state hospital from 12 to 4. That's both a good thing and a bad thing, because for this next fiscal year, while we were able to manage those funds, they look at your costs, your utilization of the prior year to pay you for the this year. So fiscal year's funding is going to be based on utilization of this past year. So we will see a decrease in funding related to that, but there's a lot of work that's occurring with community mental health in the state and contract negotiations with the department. I'm a part of that committee in regards to talking about the state inpatient and the fact that with the reduction significantly of general fund across the state, that if you end up with just a few individuals that do need to be placed in the state hospital, it could basically wipe out a CMH's entire ability to serve any uninsured in the community. So right now there are negotiations that are occurring to look at actually not requiring that of the community mental health any longer, beginning in 2016. But I'll continue to keep you appraised of that, because that has an impact on the counties, because it allows us to be able to, if you have local dollars and you have somebody in a state inpatient, you're going to have to use local if you have no GF. So that's why it's significant from the county's perspective. The other thing that we're still continuing to advocate for, and it's actually something that the department is willing to have discussions about at this point in time, again, as part of the contract negotiations, is looking at the local match obligation in Section 428. So I'm hopeful that we will be able to get some language change to allow the community mental health for it to be an option whether or not a community mental health wanted to draw down the additional Medicaid. and not require that if the local, the CMH with their local counties evaluate what their needs are and determine whether or not they want to do that. Because those local dollars are more and more valuable as we lose general fund dollars more and more. But the good news is that we have seen a significant increase in Healthy Michigan enrollment. So you'll see in that slide in there, the individuals that were funded related to general fund at the beginning of this fiscal year. We had 850 individuals, and when you look at it now, we have about 250 that are still receiving services where we need state general fund dollars, but we've seen an increase in Healthy Michigan of about 700 individuals. So we've seen an increase in individuals coming through our doors as a result of Healthy Michigan expansion. Jackson County is actually at 112% of what was projected related to enrollments. So that, again, that's another good thing as we look at being able to meet the needs of individuals for health in our communities. So that's good. The other thing that I wanted to point out was related to the challenges over the past years related to the structural deficit that Lifeways experienced. As a result of a couple of things, the work with the counties and the collaboration that we've had in partnership with you related to the local match, as well as the collaboration with facility support that you provide for Lifeways, has resulted in the fact that at the end of this fiscal year, at the closing, we will no longer be in a structural deficit, which is a wonderful thing to be in. We could not have done that without the partnership of the county, so I just want to express my appreciation for that. The other thing was related to looking at moving forward with integrated health. That is the future of healthcare. Lifeways is preparing itself and has been preparing itself over the last 2 years for that. As you know, we have the Center for Family Health on site, and that helps with being able to coordinate physical health care with individuals that also have a mental illness. We do know that if we're able to address some of those high-risk comorbid conditions like obesity, diabetes, especially with individuals who are on psychotropic medications, we can extend their quality of life. And so that is something that we are excited about moving forward. The other thing, when we look at this next fiscal year, you also see in there the strategic plan. Our board is really aggressive in the fact that we are only doing a one-year plan for this first year, that we do know that there are things on the horizon related to both Governor Snyder's blueprint for health innovation as well as the department's communication regarding their strategic direction for behavioral health that we want to align ourselves with. We've come a long way actually with preparing us for that, and there are 4 major things that we'll be focusing on over the next year. One of them is ensuring that we have a sustainable organizational model, so really looking at the health homes, the expansion of health homes into the behavioral health arena in the state of Michigan. Right now there's some pilots going on, and they're going to be expanding that. The other thing that we're going to be looking and primarily focusing on is outcomes, really looking at and putting into our contracts with our providers that drive outcomes, that we're paying for value and not volume of service, that providers can demonstrate that they're providing a quality service and that people are improving. The other thing that we're doing is related to technology, the need for us to really look at how can we get our health information, EMR, electronic medical record, to communicate with other key stakeholders in our community related to improving outcomes and coordinating that care both from the physical health side, the mental health side, and from substance abuse. So those are the key things that we're looking at over the next year. I'll continue to keep you appraised of that, but we are excited about the opportunities that lay before us, especially since we've been able to address some critical things that were a risk to this organization.
Thank you, Mary Beth. Commissioners, comments, questions you might have for Mary Beth? Commissioner Placzek?
Hi, Mary Beth. Nice
Yes.
report, thank you. When you were talking about state hospital patients, and I think you said last year it was 12, and this year it's 3 or 4,
Yeah.
what's the average over maybe the past 6, 7, 8, 10 years? I mean, I don't know if 12 was high, is what I'm getting at.
Yeah, 12 was high. 12 was high. I can't tell you that. If you want that information, I'd be happy to bring that back. I don't know what the average is over the last 7 or 8 years. I do know that not just Lifeways, but as a state, right now we are challenged with finding placements for individuals for state inpatient. Kalamazoo at this point in time, I don't know if anybody saw the article in the paper, but they're actually not accepting any patients at this point in time. There's an investigation going on at Kalamazoo State Hospital, and that, so that even limits our ability. We've had people sitting in our ER, local ER, who need state inpatient, and there's a waiting list. I think we might have swung the pendulum too far related to being able to meet the needs of some of those populations. But it's an issue all over the state.
Yeah, I worked at Northville State Hospital for a while, so I understand. But if you could just maybe go back 5 years and let me know what an average is, I'd appreciate that.
Yeah, I'll be happy to do that.
Thanks.
Commissioner Rice?
Thanks, Mary Beth. Like Commissioner Placzek just said, very good, thorough report. My comments is I really appreciate the hard work that's been done, obviously with the county, but obviously with Lifeways. The commissioners here, our administration, yourself, Lifeway board, the staff there. It's without question that hard work has helped Lifeways move ahead, and it's got Lifeways where it's at. Now we just need to get the state on board, and I guess we'd all almost have a perfect world at that point, but obviously that'll be a tough battle. But thank you.
Yeah, but it's one I'm going to continue to fight related to local match, just so you know.
Can you hear me? You can hear me? There, now you can?
Yeah, no, yes.
Yeah. No, I get it. I know you're going to work hard at this. You've mentioned this many times, and you have a lot of us who are willing to work with you. And it's something that definitely needs to be tackled because the current system, as we said many times, just does not work. Anyway, again, thank you.
All right, thank you.
Any other comments or questions for Mary Beth? All right, thank you for that report.
All right, thank you.
Next on the agenda, we have Community Action Agency, Ms. Toby Berry.
Good morning. I provided in your packet a report on the NSP program, so I just wanted to go through that with you. As you can see, we've sold 6 of the houses that we purchased. Purchased them, if you remember, they had to be foreclosed. In order for us to purchase them, we had to get a 1% discount on the purchase price in order for them to be eligible homes. And our buyers were between 120% AMI or below 120% AMI. So of those 6 houses, that last house on the list, 404 East Gulf, was a house which was a collaboration with the Land Bank and Habitat for Humanity. That property went to a buyer who was below 50% AMI, which helped us meet one of our requirements for the grant. We have 1 house on the market currently and 2 under construction. 121 Hall Street in Michigan Center is also a collaboration with Habitat for Humanity, so that will be another one that goes to a 50% AMI buyer or below. We currently have 1 house out to bid, and that's 303 Broad Street in Michigan Center, and we have 1 remaining to be rehabbed, 914 grant. At this point in time, we have met our requirement for expenditure, so we've spent the $1.16 million required by HUD. We've brought in some program income from our home sales, and we currently have $250,000 remaining to spend on rehab. Of that, 80% is already out, or $80,000 is already out to contract. So the, just under 170,000 that's remaining will be utilized to rehab 303 Broad, and then as we sell another property, we'll be able to go back and do the rehab on Grant Street. We may or may not have enough funding for one more property in there as we bring in program income from home sales, but we will gauge that as we go. We also completed 10 demolitions, and those addresses are there listed for you to see. With our CDBG program, we have 5 homes under construction. 4 are full rehabs and 1 is an emergency repair. We have 2 full rehabs that will be starting soon, but those are in our non-target areas. If you remember, MSHDA required us to identify 3 target areas, and we did. Michigan Center, Concord Village, and the Village of Brooklyn. We do have 1 potential rehab in the target area. We're trying to figure out if it's in Brooklyn Village or Brooklyn. So we may have 1 of those going, and we have 7 emergency repairs in the process. We are having difficulties getting applications for those target areas. So we have a file drawer full of applications for everywhere else in Jackson County, but we are having difficulty finding applications for those 3 target areas. I have left some flyers with Adam if any of you are interested in handing those out or giving them to anyone. We are doing targeted marketing ourselves to those 3 target areas. 50% of our grant has to be spent there. We are currently at a place where we've already spent the 50% that we can on all of Jackson County, and now we really have to target to get those other properties done. Keeping in mind that the process to go from application to start of rehab takes a while, we are hoping that we have all of those started, I'm hoping, my staff thinks I'm a crazy person, by January, so that we can make sure that we're finished by August when our grant is expired.
So I can most likely jump to the conclusion then you've had conversations with the elected officials in those villages?
I have staff people who are doing those types of connections now.
Okay.
And also doing some targeted kind of door-to-door, putting information in party stores and laundromats and any local place that we can possibly find that people might see it.
So are churches?
Yes.
So what kind of feedback are you getting thus far? I mean, so you're just in the beginning stages of this?
We are
Okay.
just in the beginning stages, yes. I think too, if we get to a point where we're still having difficulty, one of the things I've suggested to our staff would be connecting with the county and gathering the GIS address information so that we can send things directly to homeowners.
And you have the funds to do that, that would fall within the budgeting? Mm-hmm. Because I
Yes.
know mailings are very expensive.
Yes.
All right, so
And
again,
it's on our website, and it's on our Facebook page, but we're working on it.
so it sounds like a priority has got to be the communication piece of it.
Yes.
And again, a comment was made to include the faith-based organizations as well.
I will relay that to my staff.
Before Ms. Toby moves on, any other comments or questions, since I've already interrupted her here?
No, I'm
As she gets up with her.
finished.
Okay, thank you.
So, I'm done with my report, so if there's any other.
Commissioner Duckham?
Morning, Toby.
Good morning.
I have a constituent, an elderly lady in Norval Township that is in desperate need of a roof on her house. She bought enough shingles over the weekend to deplete her savings account, but it only puts about a third of the roof on her house. Is this in our target area, or where would she go for assistance?
You should have her contact Community Action Agency. Emergency repairs do not have to be in our target area. So we can do emergency repairs outside of that. I don't know that we've expended all of our emergency funds, but I would please have her contact the office and touch base with Paul Burnham. He's the staff member who's doing the applications.
Is that 788-4800?
That's the hospital, 784-4800.
Okay, thank you.
We get lots of their phone calls.
Yes, I bet you
She
do.
has donated labor, donated trash removal for the debris, but not the money to buy the balance of the shingles.
Yeah, I would have her contact the office.
Thank you.
Yep.
comments or questions? All right, thank you, Toby, for that information. Next on the agenda, we have Region 2, Area Agency on Aging. Ms. Jenny?
Good morning. I believe everyone has this information, and I'm open for any questions. I'm not going to read it all to you, but I can say some things about the funding. One being that we have more funding for 2015 due to Governor Snyder's no-wait state initiative. So there's additional funding allocated for 2015 for in-home services and meals to address waiting lists. Jackson County is over 50%, somewhere between 51% of all of the service dollars that we receive go into Jackson County. And so when you're looking at these numbers, this represents a little more than 50%. The funding allocated, I just said that, never mind, forget that, okay. I got ahead of myself, all right.
So, Jen, just so we understand, over 50% of the funds come to Jackson County.
Yes.
And the entire region covers what counties?
Jackson, Lenawee, and Hillsdale County, it's like 38% for Lenawee County, 12% for Hillsdale County, and a little, there's give or take some percentages, small percentages in there, but that comes up to 100%. And so, an example, if you'll look on page 2, you'll see that last year for our waiver department, it was $5,213,196.55 in service dollars, for Jackson County. We received upwards of $1.5 million more dollars for waiver for the fiscal year 2015 that's coming up. So you'll see this number increase 50% of that amount as well. So recently, Jackson County, Jackson, Lenawee, and Hillsdale County become a state ADRC, Aging and Disability Resource Center. We were in an emerging status for about the last year, but as of September 30th, we're a full-fledged Aging and Disability Resource Center. And the center is working closely with 211, and they're part of our collaboration to be a one-stop shop for when people call in for services to aging. They can come through 211 and be dispersed to all of the right organizations so that our seniors do not have to make multiple calls to get to where they need to be for services. When they start calling, it's easy for someone to say, well, now you need to call this person, and then you need to call this person. So we'll have an options counselor, we'll have counseling there within 211 and within Region 2, and Disability Connections and many of the other collaborative parties to help smooth out those services and help our seniors be able to meet all of their needs through the 211 process as well. I recently presented the area plan to the State Commission, who accepted it with good flying colors, so we're still moving forward with our area plan. Transportation is a really hot item for what we do in long-term care, in our 3 counties, and I took this up with the State Commission recently to say that for our future State Advisory Council, which I'm a member of the State Advisory Council on Aging, that's probably something that we really need to look into is how we're able to get our seniors and disabled to their doctor's appointments and things like this. And thankfully, with Catholic Charities in the Jackson region, without them, we wouldn't be able to, a lot of people would not be able to get to their doctor's appointments and things like that. So, any questions?
Commissioner Rice?
I'm sure everybody's, God forgive my voice. I'm sure everybody's aware of this, but the funding that the Region 2 AAA gives to Catholic charities, as I gotta call her Jenny. That's just
Yeah,
what I
it's
call her. That Jenny referred to. Just so everybody's clear, the seniors that she's talking about that definitely need the transportation are being taken care of right now by RSVP. Just to make
Yes.
that clear.
Yes, through RSVP. Thank you, yeah.
Also, if you would you update us commissioners on where PACE currently stands?
Yes, definitely. I left that one out. We've been working on the Program for All-Inclusive Care, which is a PACE program. We've purchased the property out on Springport Road, right across from Vista Grand Villa. There's the 3 buildings back way off the road there. And so architects, everyone is busy preparing to design the PACE program in that area. We're moving up to the second step. I believe they will be in business out there probably by August or September of next year. And MDCH, Michigan Department of Community Health, we're sort of slowly moving them into the process. So it's not like you're just going to open your doors and 200 people are going to walk in. They only allow you to take like 10 at a time so that, they can process and make sure everything is going to the best interest of the clients. So it's moving along. Region 2 is a 10% partner. Legion's Hospital, it appears that Legion's Hospital is going to be the medical center inside of the PACE program. It's going to employ quite a few people, and it's not in any way competition with any other programs because it's a very serious group of individuals that come to the PACE program with long-term care needs. Their levels of care would be nursing facility level of care, so.
In this PACE program, it is referred to as inpatient or outpatient?
Outpatient.
Only outpatient. So it's not in competition, as you just said,
Right.
with any other
No,
long-term
no.
PACE?
And the clients in the PACE program will have their own medical center, physical therapy, occupational therapy, lab work, pharmacy, doctors, nurses, everybody will be there to meet their needs on a daily, weekly basis. The whole goal is to keep our seniors healthier, longer, and out of hospitals, out of nursing homes, out of hospitals and emergency rooms. And so by making sure their glucose is checked, making sure their blood pressure, all those things are taken care of on a daily basis. As well as socialization, there's, a lot of times long-term care participants are not able to go to our senior centers, are not able to do some of the things, and so they're really isolated quite often in their own home. So the PACE program will help in that area as well.
And the goal is to have that up and running in place in 9-10 months?
Yes, right. Well, they're working fast, and we're at the mercy of MDCH because every step that we take has to be approved before the next step goes through. So, but I think it
challenges,
should
aren't
be the building's purchased. There's no problems there, and we're partnering. Did I say we're partnering with Chelsea Retirement Center, United Methodist Retirement Center, Region 2, and then Legion's Hospital, but I don't believe they're an equity partner. They're going to be more of a collaborative partner, so.
Any other comments or questions? Commissioner Rice?
I think you forgot this one too. I want to put you on the spot. Would you like to tell everybody that unfortunately you're going on to better things?
Yeah, this is my second time to think I'm going to retire this year, but I have made a decision that it's probably time that I retire. So we're preparing with the Region 2 Board, we're preparing to find someone to take my place, and sometime in January or February, I will be retiring. probably will see many of you because I plan on staying active as well, you know. I have my degrees in aging, and I would love to be a part of a board or any services that have to do with aging in the future. But yes, I'm going to retire. I'm going to pass the baton to somebody else, so. Okay. I don't
Thank you,
think
and
they'll
thank-
let me change my mind again either.
No,
Okay,
and thank
so-
you for your service to our community, as
Thank
well
you.
as all you've done, and best wishes as whatever doors may open for you. Please contact Delane in our administrator's office and put an application on file, because you are truly an asset, and many opportunities will present themselves where we would love to, I personally can say, I would love to appoint you to serve our community. But
Thank
thank
you.
you for your service as well.
Thank you, I appreciate that. Thank you.
Next on the agenda, we have Department on Aging. Ms. Marcy?
Good morning. Wanted to start out talking about an HPO-related transformation that we had. We've had an annual event for many years, and through one of our teams that talked about good to great ideas, the focus group recommended doing something different to get the word out in the community about the resources available at the Department on Aging. And a big part of that is information. One of the community survey, when they prioritized different items that the Department on Aging is involved with, having access to information about resources in the community was the top preference. And so we wanted to reach new people. So the idea was to do that through a classic car festival. The time was chosen the third Monday in September, which I realize is September and October are peak conference times, so it can be busy for many areas, but apparently for Classic Car Festival, it was a good time. We had T-shirts ahead of time to promote the event. It was 4:30 to 7:30 at the Jackson County Fairgrounds, and there were 120 different cars that were there. And I think all the car owners, probably 90%, were age 60 and older. And we had some younger people too. And we were trying to draw all ages, children, adult children of older adults who might be caregivers someday, again, to get the word out. The sponsor of the event was Friends of Jackson Seniors. They're a nonprofit organization, and they sponsored the organization, so no Department on Aging funds were used in the coordination of the event, although staff time, of course, was there to help. We served 480 meals. We ran out of food, so we had to stop at 480, and there's our some of our cooking staff. 500, at least 500 people were in attendance. And to make it intergenerational, we had face painting and ice cream. Again, the push was to get information out. Our staff talked with a lot of different individuals. They came inside for their meal or the ice cream and looked at the 3 different locations that had information and asked questions. We gave out a lot of information. We had what you call table tents, like what you might see at a restaurant. We're at all the tables with information about services we have. Friends paid for the cost by raffle tickets were sold ahead of time. And so the goal of the focus group of getting the word out to more people, especially caregivers, and have it be more intergenerational, and was that goal met? And it was. We're very happy with how things turned out. And the event team are pictured here. A lot of people in the Department on Aging were involved. Home care workers came and helped with cleaning up the food tables and assisting. Meal drivers were there, social work staff. So it was a nice interdepartment kind of event as well. So any questions about that particular, before I move on?
I know it's a lot of work, but obviously it's very successful. I think this should be the first annual, and you might want to think about the second one moving forward.
Yes, we're planning on doing another one next year. The date for the third Monday will be September 21st. Okay, last month, Danielle Paquette was here with me. She's our new department deputy director, and so her position of in-home services coordinator was vacant, and we had interviews to fill that position, and Jennifer Guthrie, who has been our grandparents and other relatives as parents coordinator and our caregiver coordinator, she has been selected to be our in-home services coordinator. So Jennifer has started to learn her duties from Danielle, and then Danielle will then have more time to learn more deputy director duties. Meals on Wheels, second meals. Just in passing, a few meetings ago, I mentioned that in our kitchen, the staff prepare cold meals that are a sandwich and a salad and fruit, and that it takes more time to prepare a cold meal because a person has to prepare each sandwich, whereas when you do bulk hot meals, it takes less time. So has been in the back of my mind that when we have a vacancy, to look at that configuration of our full-time and part-time positions. So at this time, we had a full-time cook retire, and right now we're going to fill that position with a part-time. We're increasing the other part-time cook hours to the maximum of 29 a week, and then it'll be posted a 25-hour-a-week part-time position. And we'll see, my recommendation to the nutrition services manager was then for us to phase out of providing a cold meal as our second meal and instead have frozen meals. So preparing more hot meals and freezing them. But I have told her, I said, if you can, and the cooks and the other staff come up with a plan and you continue to provide cold meals, I said, that's fine, whatever you want to work out, but these are the positions that we'll have at this present time. So they're working on that. And we did survey some of our clients who currently, Meals on Wheels clients who receive a second meal, about 48% receive 2 meals a day, and asked them, if we went from a cold meal to a frozen meal, would you continue receiving that second meal? And 72% said yes, we would still want that second meal. Some people prefer a second meal because it is a cold meal, but the option would still be there that yes, you can have a second meal. It just might be a frozen meal that you need to reheat instead of a cold meal. So the kitchen nutrition program is still working on that. And then Friday is our annual volunteer recognition at the Human Services Building in the lower level. And there's a great parking lot in the back, so all the staff can park in the back, and we'll have plenty of parking, so that's nice. Any questions?
Comments or questions? Commissioner Placzek?
Hi. Just a couple of questions. One, I support the frozen meals. I think that's a great way to eliminate waste, because if they're not hungry and it's a sandwich, it's not going to be good the next day maybe or day after. But is heating them a problem for anyone?
We make sure that they have a way to heat the meals before they even start meals. That's one of the questions. And people do have a microwave and know how to use them. They can be reheated in an oven or like a tabletop oven as well. But that is something that we ask. Yeah. Okay,
Thank you,
thank you.
Marcy. Next on the agenda, the Animal Shelter Quarterly Report. Welcome.
Good morning, Commissioners. Hope everybody had a good weekend. First, I'd like to really bring attention to Friends of the Animals of the Jackson area because, as you can tell, they're continuing their partnership with us for spaying and neutering animals. In fact, we just received a check from them in the amount of $2,500 to help defray some of the costs for spaying and neutering. To date, this year, we have, with the support of the Friends, 180 cats were actually spayed and neutered. A large proportion of these are what's kind of known as community cats. We kind of basically work out deals with the people who would normally be bringing these in to just put into the shelter. We kind of interview them, we ask them questions, and oftentimes we can get them to, if we spay and neuter them for free, they will take that community cat back to the neighborhood, and it lives out its life, but it cannot reproduce, which is why we're also starting to see lower intake numbers because the efforts are working. We're not the only ones doing this. Cascades is also participating. This is kind of a nationwide effort in actuality. So it's one of the key things, and the Friends of the Animals are a very key supporter in all of this. We also, with help from the Friends, again, we did our summer Pets for Veterans campaign, and we, for the first time, came very, very close to reaching the $2,000 in adoption fees to be reimbursed by Friends. In fact, we came up to $1,800 a veteran took a second cat for $1. That's kind of why we have that $1 on there. We are going to do it again for this Veterans Day holiday period. We've talked with Friends again, and they are willing to support that effort one more time. So it's an exciting time. We'll get that word out. We'll do a little media campaign. We'll get some flyers up and about out on the webpage, some social media stuff as well. We also participated in a weekend event on September 14th. A couple of our volunteers took some of our dogs, a couple cats out to PetSmart. We did not adopt any out at this particular event, but I do believe we pulled in 1 or 2 volunteer applications from folks that were participating. Cascades was also out there during that one. We just last Friday, I believe it was last Friday, September 26th. No, a couple weeks ago, actually. Time flies when you're having fun, as they say. We started our Da Vinci students coming through, and this is a collaborative effort between Da Vinci and the health department, and we will be having 6 more groups of these students come through on a monthly basis, one Friday per month, and it's a different group each time they come out. They help us do some activities. We're not having them clean up, but we are having them actually provide some services for us. It's not just a walking the dog and having fun. This is actually, they're doing some community service at the shelter. Also we have had some position changes. Permanently, our administrative clerk is Marie Adams. That has taken place this summer. She was the previous full-time kennel attendant, so now we've got the part-time kennel attendant has moved up to the full-time position. And it's not indicated in here, but today I'm actually offering our casual kennel attendant the part-time kennel attendant position. As you can see, it's an internal moving up the scale. It's very good for our staffing, minimal training needed. Each person really knows the job already. And so now I'm going to look to find somebody to fill in for the casual status employee.
Don, I think I'll stop you right there. At this point in this presentation, any comments or questions? Commissioner Shotwell?
Don, if a resident of the county brings in a feral cat on Mondays, or are they allowed to leave the animal with you, or have we changed that policy that they're only accepting cats on the other days of the week?
Well, we have changed our policy to afternoons on Tuesday, Wednesdays, and Thursdays. We've posted that. It's a soft policy at this point in time. People are coming in, and we've discussed that. If it's extremely inconvenient for them to come back on a Tuesday, Wednesday, Thursday, yes, we have taken the cats in. But it's kind of an interviewing process. We're doing it for work management reasons. In reality, Mondays are extremely busy. Fridays are also extremely busy. Our goal is actually to have the shelter cleaned and ready for presentation. All the cats and dogs medicated, the ones that need medications, the cages cleaned, the laundry starting to get going, versus having people bringing in stray cats at 9 o'clock in the morning, 10:30 in the morning when we're not quite ready to accept them. Does that help?
Well, I guess my question is, what do we tell these people who on Saturday afternoon have caught a cat, and the cat has now spent 36 hours to 48 hours in a cage, has received no water, no food because the animal is hostile? What are these people supposed to do with this feral animal?
Well, that gets back to that, we're doing a little interviewing and discussing the situation, and something like that, we would take the cat in. We would make an exception. Like I say, it's a soft policy. We're trying, do I expect all 100% of cats coming in to be Tuesday, Wednesday, Thursday? No. That's unrealistic, but if we can get the bulk of our cat admissions into those days, it helps with our staff management and work management.
How do we answer to the general public by returning cats to the neighborhoods, the bird destruction and other things like this that we know cats are involved in?
Well, I guess we're talking about, I do understand that the Audubon Society is not real happy with community cats, feral cats population out there. The other hand, euthanasia, we have a group of people upset on that, so we kind of have a dichotomy here of issues with people, different groups on different sides of that argument. We are decreasing the cat population overall over time with this spaying and neutering. That's the key point to remember. And is it a little bit slower process than if we just euthanized? It might be, but it's definitely more effective, and it's kinder, gentler. It's getting into our overall mandate. So, that's how I would have to answer that group. There are plenty of owner cats that are out and about in the evenings or during the daytime that are not house cats, and they are actually one owner cats, but they're just outdoor cats.
I just have to be able to explain to both groups. I'm fully aware, both groups visit with me regularly.
I can imagine.
I'm a National Audubon Society member, so yeah, I am involved in that side, but also I'm involved with the friends and a lot of the people that come and visit with you. So yes, I just want to be able to explain the situation on what our policy really is and what our long-term goal is.
Right. And if you can point out that our cat intake has significantly come down, the demand side of things is pretty even. It's 950 cats per year, plus or minus. We've come down from 3,000 cats a year intake, and we're in the 1,700, 1,600 range. This year might be 1,600. And, that's a definite track toward supply meeting demand. We've historically tried to increase demand, and it has not worked. Apparently, that's the carrying capacity. So that's probably the point to make. We are decreasing that cat population and thereby helping the birds, because cats will do some hunting.
All right, Don, before we move on to the last part of your printed report, we have one more comment or question. Commissioner Duckham?
Good morning, Don.
Good morning.
I guess I don't understand. A community cat, we're talking about a stray cat?
Let's call it a semi-stray cat, because it is being fed. It is being fed by one or two or more homeowners. It doesn't necessarily live in a house. It may have a nice little shelter provided by a homeowner, but it's not necessarily a owned cat per se.
So I guess I have a hard time understanding why we want to bring a cat like that in, spay or neuter it, and spend the money on that, and then we just put it back out within the neighborhood where a dog might get it or get run over by a car, or it might starve to death in the winter.
These cats tend to be healthy. These are not your true feral cats. a true feral cat is a very extremely hard cat to catch. Okay, so these are really domesticated cats that do not have a true owner, but they're being cared for by one or two homeowners. And they're willing, and these homeowners are willing to continue to do that as they have for a year or two or three sometimes. But in this case, they're also not reproducing and bringing in a litter of kittens to us every year.
All right, thank you for that answer, Don. Administrator Overton?
I was just going to add to that. I think Don has stated as such, but the data that I've seen thus far indicates that this program is much better at reducing the overall cat population than it is to just bring them in and euthanize them. It doesn't, on the face of it, it doesn't sound like it would, but when you see the data, it really does. It does. I would be happy to share that with any and all.
At this time, we would love to hear the remainder of your report as we jumped right in the middle. I believe we're on the top of page 2.
I believe so, yes. And as you all well know, we did receive a grant in the spring to buy a new software case management system. It has been installed. We had 5 days of on-site training by the company, Chameleon. And by all, it's working like a charm. That's, the staff is extremely happy with it. We are getting better information getting into the system concerning each individual animal. From a medical side of things, there's better coordination with the kennel attendants and ensuring that. So over time, we're expecting great things. We're probably only utilizing 20-30% of the system at this point, but given more experience, I hope to increase that and use some of the other aspects. We also signed a 1-year extension for our vet tech, and so it's a little bit more detailed contract. Mr. Overton can probably give some details on that, but there is a little bit of cost savings there as well. And then, Friends of the Animals are coming back into the picture here. They sponsored a golf outing, a first annual, to benefit the animal shelter. It was brought to me by a couple folks, including Brenda LaChapelle and Lori Sumala and Denise Bauman. They're the ones who primarily organized this. They got started in the spring. It all took place on September 13th, and in the end, over $7,000 are being donated as a result of this golf outing to the animal shelter. And the funds are going to be designated to doing some improvements in the cat room. We're going to create 3 more cat colonies. It's better, lowers the stress level for the 5, 6, 7, 8 cats that can be in a community colony type of situation, and also better storage underneath the individual cat cages. So that's primarily where the money is being targeted. And perhaps next spring, it's not going to happen this fall, but we're considering an outdoor play area for dogs, fenced in so that they can actually get exercise, a soft surface rather than concrete, and burn off a little energy. That'll also help bring down the stress levels.
Right.
Would there be any questions? That's about the end of my report.
Don, I'm hearing a reoccurring theme as you speak and give your presentation, and that is Friends of Animals. I mean, throughout the duration of almost every component of your report, these volunteers who are raising funds and donating for a worthy cause are to be commended. What is the size of this organization? And do they meet regularly? If someone wanted to get involved, are there opportunities?
Yeah, they do have a website. That's not a big organization. They have probably 3 or 4 different major events, fundraising events per year. They have a Craftorama coming up. I do not have that information right with me, but I can certainly get that. That's coming up down at the Fair Center, and I believe it's the end of this month or maybe beginning of November. The date slips my mind, but that's one of their major events. They also do Bowl-O-Rama. That's one of their major events. So they do several of these fundraising. They also donate to Cascades, some rescue groups as well, and that's their whole purpose, is to help establish groups, essentially with funding, to do certain aspects.
Well, please express our appreciation to this group when you speak with them next. What other comments or questions might you have for Don?
Well, I thank you very much for your time.
Thank you.
And feel free to give me any questions, contact me or anything along those lines.
Thank you. Next on the agenda, the Health Department contract with Livingston County for medical director services.
Good morning, Commissioners.
Good morning.
We've had the contract in place with Livingston County since 2007, and the provisions of the contract really haven't fundamentally changed that you're looking at in your board packet today. The fundamental request from Livingston County really is that we amend the agreement with them to provide the ability for them to pass along the additional costs that they may incur from year to year associated with personnel expenses with the medical director. So that was the primary reason for reinitiating a renewal of the agreement. And we've agreed to do that with them. It's been a good relationship, and it's worked out very well for us in Jackson County, and we're very appreciative of the services Dr. Lauren Chuck provides us.
Right. What comments or questions might you have? Seeing none or no additional information to be presented, I'd be looking for a motion to authorize this contract to the full board.
Support.
We have a motion and support. Any additional comments or questions? All in favor say aye. Aye. Opposed? All right, that will move to the full board then. Next on the agenda, we have the Health Department monthly report.
Thank you. It's been a very busy month and interesting times as we deal with a number of different communicable disease issues out there, including Ebola and enterovirus D68 as well. I have a number of things I want to highlight in my report here, but first I want to take a second to introduce all of you to Angela Vidito. Angela is our new Director of Personal Preventive Health Services, registered nurse with BSN, right there. And I asked her to join us today as well in case you might have some questions about a piece of our report regarding the STD clinic numbers. Angela is joined us in July as the director and is currently will be working on completing her master's degree over the next 3 years. So in terms of my report, a few things I'd like to highlight. Really excited that we were able to submit an application for the Michigan Department of Community Health Director Award. I don't know that we'll get it, but I think we've done a lot of work here in Jackson County with health improvement and health integration, and I hope that we're able to be recognized that way. We continue a lot of the work with Allegiance Health and Health Integration. The provider survey on behavioral health diagnosis has been out now for a couple weeks and will probably continue through the end of October. And we are working on doing another survey of mental health providers in the community who are not physicians, if you will. Many of those folks work contractually and independently with Lifeways as well. So we're working on that. An initiative that actually was started last year is a primary care-oriented research initiative. Dr. Mike Klinkman is the medical director for the Jackson Health Network, and he has been working with integrating behavioral health for some time. He's had a depression screening project in place in 3 or 4 pilot Allegiance Health Family Practice locations within the community, and the results are very encouraging in terms of using a health coach to help people and provider offices create better outcomes for people that have been diagnosed with behavioral health needs. So now what we want to do is expand this into a full-fledged research project to really determine whether or not we achieve better patient outcomes with behavioral health in a patient-centered medical home setting. And so I've been asked to participate in that project with the network and to serve as also a co-investigator. So we're really excited about moving it forward. I think it ties in very nicely with a lot of our health integration efforts overall. We're continuing to work on population health measures with the Jackson Health Network and on our public health service integration project. I think I may have previously indicated that what was chosen was lead testing and referrals, both from the Health Department and Michigan Department of Community Health and from Allegiance Health as well. And so we had to step back a little bit and rework our protocols so that we were clear about what we were doing on this project. And we're getting very close now to finishing that protocol and going back to our meetings with Allegiance Health. I include quite a bit of information in the report on human enterovirus D68. You may or may not be aware that there is an emergency department syndromic surveillance system in place and in operation here in the state. And I don't know necessarily whether all hospital EDs are participating in it, but ours here at Allegiance Health does. And we get alerts very quickly from this system when there's an indication of increased signs and symptoms. In this particular case, it was respiratory that occurred back in September, and we received those notices very quickly. And we kind of also figured out that Allegiance Health was not necessarily in the information loop on when these alerts come out from MBCH, so we've added them now into those alert groups, and they will be receiving those right along with us. We received a media inquiry on September 24th from WILX-TV inquiring about any confirmed cases of human enterovirus D68 in Jackson County. So far, to date, we have not had any confirmed cases, although we have had at least 4 patients that have been tested for it. Very sad news to learn of over the weekend. We lost a toddler in the Detroit area to this particular virus, and we're hoping that it doesn't show up that way here in Jackson County. We did deal with a potential respiratory illness outbreak at the Jackson County Medical Care Facility in early September. They had 7 residents that were reporting signs and symptoms of coughing and wheezing. 2 had x-rays findings of pneumonia, and unfortunately one of those residents 2 of the 7 residents passed away, one at Allegiance Health and one inside the facility. That doesn't necessarily mean it was associated with this viral illness, but the coincidence is a little concerning. But we did provide as much information as we could to them in terms of how to control that kind of a viral outbreak, and whether it's this particular one, whether it's enterovirus or norovirus, they're pretty much handled in the same way in terms of the prevention and control measures. We are excited to announce that we do have our part-time public health nurse position in the STD clinic has been filled, and Tracy Fowler will start with us tomorrow, and we're looking forward to her working with us and with staff to address some of the clinic issues that we identified in this separate report. We're continuing to work on the flu immunization forum with our partners in the community. We want to expand that to be a coalition that looks more broadly at a wide array of immunization levels in the community, and particularly at vaccine-preventable diseases. So Angie's taking the lead on that, and she's working very closely with her staff and with Allegiance Health staff and other facilities in the community on doing that. We had our first employee annual flu clinic on September 25th. We provided shots to 96 county employees on that particular day, and we've been encouraging people to come to the health department ever since during our open flu clinic hours to get their shot. And we're emphasizing that this seems to be the season of virus, if you will, and we'd really like as many people to get vaccinated as possible. We continue to have a few cases of pertussis reported to us. Again, another vaccine-preventable disease, so it kind of underscores that we do have it occurring in the community, and we can do more about it. We did work closely with the U of M hospital on this concerning the student that was at a local college here in the community, and they have recovered fine with no further complications. But we're always involving making sure that we're doing good evaluation, post-exposure treatment, and working with the healthcare folks to get that accomplished. We did submit an application for expansion of the Parents as Teachers program. This is a secondary prevention-oriented program for families that have maybe already had one instance or episode of child abuse and neglect. And we think that our Parents as Teachers program, which has been very successful in the early on program, would be of some great assistance to these families. So we've made that application, and it could provide up to $50,000 per year through the Children's Trust Fund. We received notification that our Early childhood programming allocation from the Great Start program will be $34,000. It's less funding than we asked for, but it's $2,000 more than what we had this particular year. So we're pleased to receive those funds. And Barb Bowman is also going to be applying to the Community Foundation for a $5,000 grant to help defray some of the expense between what we received from Great Start and what it will cost us to provide the service. If we're not able to get as much resources as we need, we simply have to cut back a little bit here and there to make it fit. We move forward with our recruitment in the WIC program for the combined hearing and vision technician position. That's in place now, and I thank you very much for helping us make that happen in the health department. We also had our biannual, if you will, every 2 years, WIC management evaluation, and we scored very well in that overall review. We had one citation that really was staffing related. It requires us, depending on whether it's a child or a woman and their pregnancy status, to be able to get them an appointment within 10 to 20 days of their initial call. And we had some problems with our CPA staffing levels that were affected as a result of a couple of losses, and that resulted in us not having met that criteria at the point in time that we had the management evaluation. We've since replaced both of our RD positions with new people, and we no longer have that waiting list in place at all. So we're good to go. The staff did a great job. Julie Weisbrot, our Healthy Communities Coordinator, partnered with Dr. Schultz, our co-medical director, to write an application for the Building Healthy Communities grant. We're really excited about what we're going to be able to do with this particular grant. We did receive notification of award of $77,235 beginning October 1st of this year. And we're going to be working with the City of Jackson and their Parks and Recreation Department on benches and also completing a walking trail loop around Loomis Park in the Central City area. So we're really excited about being able to achieve that particular award. The Healthy Michigan Plan continues strong. I know I have 6,843 Jackson County residents enrolled in the plan as of when this report was prepared. It's now over 7,000, and I think the state has more than exceeded their original goal of something in the range of 325 to 350,000 people enrolled this particular year. It is now at 400,761. So a lot more people having access to care, and hopefully this will create the opportunity for less uncompensated care in the community in the long run. So we're happy with that. As you can see at the bottom of page 5, we continue to provide a lot of insurance application assistance at the health department. We've been doing that for many, many years, and we continue to provide that. I provide you with a lot of information on page 6 about the childhood lead poisoning prevention program and activities that are going on, both with the registered property owners, the landlord associations, and educating them about how to take care of lead poisoned or lead-based paint that may be present in their facilities. So we were very positive received at that September 22nd meeting. But we are going to follow up with the city concerning demolition of properties. They expressed some concerns about how those controls or what controls might be in place when we decide to demolish a property that is older than 1978 and potentially likely has lead-based paint in it. So we're going to follow up on that. Maybe there's even an issue for demolitions that we're doing in the county as well. So we can follow up with Toby on that. So lots of things going on as usual. Environmental Health had a very successful household hazardous waste and electronics collection event on September 27th. We had approximately 185 cars through in a 4-hour time frame. The appointment process was really a notable success, and from what I'm hearing, that's probably 40 to 50 more vehicles than we had the last time that we had the event. So very well received by the community, and people seem to be quite pleased with the ability to come and drop things off. I think Don has already pretty much updated you on the animal shelter, so there's probably nothing more I need to add there, and I'd be happy to answer any questions you might have about the monthly report.
Comments or questions regarding the monthly report? Commissioner Placzek?
Richard, I know at our clinic, if somebody gets injured, we end up giving them the Tdap now instead of just tetanus toxoid. Do you know if that's commonplace in family practices?
I don't know, but I can certainly find out. I'm really glad you asked that question, because giving Tdap in all of our facilities across the community when there might be an injury is one way of helping boost the level of protection for pertussis in the community, not just tetanus. So thank you.
All right, moving on to the second piece.
We prepared, based on a request from Commissioner Alexander, a report on our STD clinic visit and revenue history since implementation of the out-of-county fee back in June 1st of this year. So we prepared the report, and I think you can see, for the most part, that the fee really didn't have a significant effect on the number of visits taking place within the program and within the clinic at the health department. And that's just kind of looking at the numbers. Perhaps the bigger issue for us is really the significant drop-off in clinic visits that's taken place since 2010. We're down about 47%, and we have done some analysis internally to try to figure out what's going on with that. And I think it's a combination of how we were operationally running the clinic and managing the staff providing the services. So with the new PHN coming on board tomorrow, our part-time nurse that'll be doing the STD clinic, we're going to be changing our operating hours to 5 days a week, pretty much 8 a.m. to 5 p.m., and planning also to be open over the lunch period, because we do have people come in during a lunch period looking for help and looking for assistance. While our overall STD rate, if you will, per 100,000 has continued to be pretty consistent over the past 5 years, with a bit of a dip in so far in 2014, it's only dropped about 15%. So what it fundamentally means for us is that people are going someplace else for STD clinic needs, and I'm glad that they're at least getting them, but at the same time, we want to make sure that people are aware that the clinic exists here to support their needs. About half of the people that come to the STD clinic are coming not because they've tested positive, but because they have concerns. And this continues to be one of our highest rate diseases in the community, so we want to really try to make a difference over the next 12 months with the staffing change I've described, and then we'll report back to you after that.
Well, thank you, and I must commend you and Ms. Vitito. Thank you very much for this data, so that as we make and adapt policies, that we have some information to follow up on it.
Yeah,
It's very beneficial.
We like to get you feedback on policies you implement.
Comments or questions regarding this presentation? I believe we are all set at this end, if you are at yours.
I am.
Again, thank you. I believe so. No, thank you for asking that. Okay, next on the agenda, we have the contract with the Jackson County Intermediate School District for their early on services. It is my understanding this is a contract that has been in place for many years, but just needs an official approval from the full board.
Correct.
Any other comments or questions regarding this contract? Any additional information from your end, Don? Nope? Okay.
I'm good.
Support.
We have a motion and support in favor of moving this on to the full board. All in favor, say aye. Aye. Opposed? The same? All right, this will go on to the full board then. Thank you.
Thank you.
Next on the agenda, the Cradle to Career Partnership Agreement is in front of you. Adam, would you like to address this, please?
Sure. As part of the Jackson County Strategic Plan on Education, we have worked with the Cradle to Career Network, and the board approved in something, I believe it was a year and a half ago, to support that. And since then, the network has created a formal partnership agreement, and that's what's before you for consideration. We recommend approval.
So when you look at the document that's attached, the actual agreement that they are asking, that we're requesting the signatures be placed on, I see maybe, Adam, the last bullet point under as a partner, maybe we need to remove any additional pledges here. Just clean that up
Okay.
a little bit there so that we're not leaving it open-ended when we sign. But this is the document. It would be acceptable to the Cradle to Career network if we needed to modify this to some extent. But we believe the document as it stands right now should fit, again, following the strategic planning priorities. So, comments or questions regarding this document?
Make a motion to move to full board.
We have a motion and support. All in favor say aye. Aye. Opposed, the same? All right, this will go to the full board. Next on the agenda, we have the claims from September.
Support.
We have a motion and support. All in favor say aye. Aye. Opposed, the same? I do not see any other minutes attached in our board docs. We have a November reporting schedule of Department on Aging, Health Department, Lifeways, and Medical Examiner. That leads us to public comment. Is there anyone in the audience that would like to address the board? Any public comment? Seeing none, are there any committee member or commissioner comments? Commissioner Luchka.
The Friends of Animals Craftorama is the 19th, this weekend, October 9th.
Any other comments or questions? Seeing none, we'll adjourn to the call of the chair.